panowie. Super. Ja bym bardzo chciała prosić grzecznie i jeszcze nieformalnie, bo wcale mnie tu nie ma, o powolne zajmowanie miejsc, dlatego że spróbujemy zacząć o czasie, dlatego że będzie też transmisja, więc bardzo nam zależy, żeby ci z Państwa, którzy nie mają przyjemności pić z Wami kawy, też nie musieli na nas czekać. Powolutku zapraszam na miejsce.
You think you don't know anyone with depression. You're probably wrong. Depression can affect anyone. Around 40 million people in Europe suffer from depression each year. Depression is associated with deep distress and is a huge burden to those who are affected. According to the World Health Organization, depression is one of the most disabling disorders in the world, affecting roughly 1 in 5 women and 1 in 10 men at some point in their lifetime. Each year in Europe, it is estimated that around 7% of people experience an episode of depression. Depression can affect anyone. Men and women of all age groups, education levels, and social and economic statuses suffer from depression. Depression is a real disease. All areas of life are affected and compromised when depression is present. Family, parenting, marriage, relationships, making friends, work, studying, careers, and finances. Depression often reoccurs after an initial episode and can become persistent or chronic if left undiagnosed and untreated. Around 3 out of 4 people who suffer from depression do not receive adequate treatment. There is a close relationship between depression and suicidal behaviour. A substantial number of depressed people die by suicide. In the European Union alone, each year around 48,000 people die by suicide, compared to around 23,000 by car accidents, and more than half suffered from depression. According to the World Health Organization, approximately 800,000 people worldwide die from suicide every year, and the rate of attempted suicides is approximately 20 times higher than this. Suicide has become a serious public health concern. Due to the close relationship between depression and suicidal behavior, it is envisaged that preventative actions which improve the care and optimize the treatment for depressed patients may contribute to a reduction of suicidal acts. Access to care of depression and prevention of suicide is a challenge for Europe. Due to COVID-19 pandemic, risk factors for depression and suicide, such as reduced mental health care, social isolation, disturbed daily routine, and financial stress, have become more prevalent. Depression can be treated. Psychotherapy or antidepressants, or a combination of both, are effective treatment options for depression. If you don't feel well, seeking help is an important first step. Information, self-management, and contact details for help are available in different languages at www.ifightdepression.com. The European Alliance Against Depression, EAAD, is an international non-profit organization targeting optimized care for people with depression and the prevention of suicidal behavior. More information can be found at www.eaad.net.
Dzień dobry Państwu. Dzień dobry. Przywitała Państwa Krystyna Janda. Myślę, że tego głosu nie da się z żadnym innym pomylić. Depresja może dotknąć każdego, depresja ma wiele twarzy, depresja jest prawdziwą chorobą. Te zdania będą tego dnia padały pewnie wielokrotnie, dlatego że spotykamy się tutaj w gronie osób, którym zależy na tym, by ta wiedza była powszechna i pomagała nam wszystkim w radzeniu sobie z kryzysami i trudnościami. Ja nazywam się Justyna Suchecka, jestem dziennikarką, która przeprowadzi Państwa przez ten wyjątkowy dzień i jestem osobą zmagającą się ze stanami depresyjnymi. Myślałam, że będzie to
person
dużo łatwiej powiedzieć.
who's
Kiedy mówi się to tak często,
episodes
powinno się
of
ograć, ale jeżeli czasem
depression, I
załamie mi się
thought
głos,
it would
to
be
dlatego, że mam
easier to
poczucie, że
say.
dzisiaj Państwo są
If
tutaj
at
z nami,
times my
by robić
voice
ważne rzeczy,
will
by takie
falter
zdania,
or
jak
tremble,
depresja może dotknąć każdego,
that's
mierza się ze
because
stanami depresyjnymi,
sentences or
nie
words
wymagały
like
trudu i odwagi,
depression
by
can
je wypowiadać.
affect
Nie
anyone,
wymagały namysłu, czy jesteśmy
shouldn't
na to
be
gotowi,
hard to
tylko
say,
były oczywistą
shouldn't
częścią naszego
require
życia. Spotykamy się tutaj
preparation.
w
They
Światowy
need to be
Dzień
part of
Zdrowia
our life.
Psychicznego. To
This
nie jest
is
przypadkowa
World
data, tak jak
Mental
nie jest
Health
przypadkowy
Day,
skład osób,
and
które
the
zobaczą
date
Państwo na
is
scenie,
no
ale też
accident,
wiem, że Wy nie jesteście
just
tutaj
as the
przypadkowo.
persons
Państwo
on
przyszliście
stage
tutaj
have
po
not
to,
been chosen at
żebyście dzielić
random,
swoją
and I know that all of you have come here to share your knowledge, your know-how, and to support the Alliance, as well as to celebrate, because we have reasons to celebrate, not just to complain. The organizer of this event is the representative office of the European Commission in Poland, the Alliance Against Depression, and the World Health Organization in Poland. I want to welcome everybody who's here in this room and all those joining us online. This is being translated. There is interpretation provided into Polish and English. You have all the presentations are available in Polish on channel 1. And on channel 2, you will receive the English translation. Those of you online can also avail themselves of the interpretation. I will not introduce all the persons and institutions and organizations who will be speaking. There will be time for that when I'm inviting them to come up on stage, but there is a group of people whom I would like to welcome and who I hope will receive a round of applause. These are the mayors of the districts of Warsaw, who today will symbolically be signing a document that will be our guiding light. So let's give it up for the mayors of the districts of Warsaw. Now that's a lot better. It made me feel invigorated. It made me feel better. So thanks to all the mayors. This meeting will not be a conference, a typical conference, so we will have lots of time to interact. There is a coffee break scheduled. Those of you joining us online can make yourselves a cup of coffee in the comfort of your own home. We will, before that, however, have a number of presentations, both formal and based on life experience. There will also be a debate, and the purpose is to demystify depression on World Mental Health Day. And I won't take up too much of your time, and I want to invite our first speaker, Bartłomiej Balcerzyk, the head of the Social Communications Department at the European Commission office in Warsaw. Ladies and gentlemen, good morning. Ladies and gentlemen, I would like to welcome all of you on behalf of the European Commission representation in Poland. The mental health, people's mental health is an important topic for the European Commission, now even more so than previously. Recent years have brought us the challenges of the pandemic, and this difficult period has affected the mental health of people in Europe and outside of Europe. In May of last year, during a project that was organized by the Commission and an event launching the project, a conference on the future of Europe, Polish citizens, people from Poland, especially young people, indicated mental health as an important topic. A topic that required European-level commitment. The European Commission actively supports efforts to improve the mental health of the people of Europe. Mental health as an important part of the welfare of citizens with the well-being of citizens is an important part of projects that aim to improve the health of Europeans. Today's event will be focused on depression. Over 6% of the population of the European Union have depression, and 1 Pole in 5 exhibits symptoms of depression, which is why it's so important to speak about depression, to inform about methods of treatment and prevention. This is being done by local alliances against depression. These are networks of support. Local alliances are part of the EAAD BEST, the European Alliance Against Depression. It's a best practice program on the treatment and prevention of depression. Depression is a condition that affects not only those suffering from it, but also their loved ones and their communities, which is why a community approach is so important. We have here with us today the mayors of various districts of Warsaw who will be signing a declaration against depression, and the districts of Warsaw and local alliances can serve as an example for Europe and indeed the world how to tackle depression at a local level, to focus on the individual and the community. Today's discussions, the purpose of today's event is to inform about depression and methods of treatment and prevention at a local level. Your communities can help persons suffering from depression. Once again, welcome, and thank you for being here at this important event. And now I'll be encouraging you to applaud our speakers. Thank you very much, Bartłomiej. And our next guest is Dr. Paloma Kuci from the World Health Organization office in Poland. She is the director of the office.
On behalf of World Health Organization, I want to welcome you to this wonderful event. Today is the World Mental Health Day, and actually it's a reminder of how important mental health is. I think it's a day that all of us can relate. When we are depressed, we are feeling blue, we have someone around that is not feeling completely okay, when we have anxiety for an exam, for a person that is sick, for so many things. And this might not get to be a mental health disorder, but certainly we can relate to all those people living with a mental health disorder and this problem. Actually, 12% of the Europeans live with a mental health disorder, and many of them preventable, because it's estimated that around 15% could be related to inclusion, considered a neurological disorder, or if we include dementia, it will go to 50%. When we look at the Polish society, about 23% of people between 18 and 60-year-old have a mental health disorder. And the most common cause is alcohol abuse. Around 11% of Polish people taking alcohol in abuse suffer from mental health. We can also include 3% for depression and anxiety. The world has changed, and we are getting out of the COVID pandemic, and this changed the paradigm. Many people were staying at home long terms. The kids were not able to go to school, playing with their friends. Elderly felt lonely as ever. And this has increased the mental health problems as well as the mental health disorders. Mental health is the 8th leading cause of daily, which means disabled adjusted life years in Poland. Altogether, mental health today gives us the opportunity to rethink all these problems, where the world is going, and rethink how we can all support people living with mental health disorders or going through depression. We have one more factor. Again, I want to remember that the world is changing, and the new factor is the war in Ukraine. We have, Poland has been incredible. We have received, you have received with solidarity and generosity, millions of people coming to Poland. About 1.4 million want to stay in Poland, and they are coming with a very traumatic event. They went through a terrible situation, a very hardship journey. They left behind their loved ones, their brothers, their sisters, their husbands, their boyfriends that could not come to join them here in Poland. These are mothers, children, elderly people that left everything behind, their homes, their houses, their security, and came to Poland. They found a very welcoming place, but that doesn't mean that they are not going to a very traumatic situation. It might not be that a mental health disorder, but certainly we can all relate to the situation that they are going through and all the needs that they have. According to WHO estimates, approximately 20% that people that go through an armed conflict event will have a mental health situation. This goes from depression, anxiety, post-traumatic stress disorder, bipolar disorders, and schizophrenia. And if we include several mental health conditions, preconditions, they will increase another 5% among all of these. Doesn't mean that everybody is going to need treatment or is going to be needed in terms of pathological health disorder, but they are going to be needing mental health and psychological support. And I'm very pleased to say that Poland and all the international organizations and all the players and the local players are making sure that our guests from Ukraine are receiving this treatment. But today is an opportunity to think, what can I do? What can I do to help this newcomer? What can I do to help my neighbors, my family, my friends for mental health? And there are many things. The first one is being aware, know about mental health, and think how we can help just by listening, by accompanying, by being a friendly ear. At the Mental Health Services, I'm representing World Health Organization, and at the Mental Health Service, it's very, very important that primary health care is a very good entry point. And then when doctors and nurses and other healthcare providers are able to recognize and help these people with a good referral and at least a very good entry point. And finally, as a community, we need to be open, we need to be welcome. We were talking about how important it is to understand, to know, to destigmatize the mental health, to be able to say that you have a problem, that you need help. And we also need to recognize also the situations that can affect us. It's very important that we can talk about burnout, that we can talk about anxiety, that we can talk about problems at home. You know, things that if they are not treated, think and take care of, will lead to bigger problems. So again, today is the World Mental Health Day. We remember this every year, and today is one more opportunity to think what we can do and recognize our needs in order to have a very good mental health life. Thank you, and welcome to the meeting.
Well, thank you very much, Madam. The phrase "all together," I'm sure, will be cropping up throughout our event, and we'll have a chance to talk about that. Now, may I ask on stage Dr. Piotr Toczyski, who is head of the Alliance Against Depression Secretariat. I give the floor to you. A very good morning to all of you. It sounds rather bizarre, Director of the Secretariat, but see, Alliance is not something that has a clear-cut structure, like a ladder would. We are there in the local community to be able to work on 4 levels and act speedily. I will tell you very briefly how we came to bring this method to Poland. In fact, there are over 120 alliances of this kind in Europe. I was raised in Warsaw. When I was 10 years of age, I was a beneficiary of the psychological counseling service, which was beneficial in many ways. Later on, I graduated from the psychology department of the Warsaw University. So Warsaw was an obvious place for me. This is where I wanted to focus my activities related to psychological policy, psychosocial policy, perhaps the psychology of health activities too. Now, health promotion group included EAAD BEST method amongst its tools. This is a methodology which was built 20 years ago in Nuremberg for the first time, and it applies on 4 levels to local or even hyper-local community level, places which are not immediately associated with mental health. There is a level of local communities, there is a local of the mayor's offices as co-designers of the policy. So we are talking about the community of about 100,000 persons. We have impact on the general practitioners. It is very important to work on the level of primary health care. It is very important for the guidelines that we promote to reach general practitioners in primary care so that they can actually use the screening tools for depression and make adequate referrals. Now, on the second level of activities, we target important recognizable characters. Krystyna Janda, whose voice you heard a moment ago, is one of them, but there are many more. And we managed to muster up this impact on this second important level. The third dimension is those who represent patients and those who are vulnerable, or vulnerable persons' family members, who may also be exposed. 20%, according to the research, show the symptoms of depression. PHQ-9 questionnaire was used to determine that, and there 8 major symptoms are inquired about. So we talk to the entire local community, and the public events that we've put in place, about 10 of them, some of them can be seen on the YouTube. Many prominent experts speaking about how to handle depression on the 3 aforementioned levels. And you can expect activities of this sort in 18 districts of Warsaw, and this would be free of charge. The only cost really contributed is the energy put in by the voluntaries. Now, EAAD BEST groups together alliances, not just in Warsaw, of course, Estonia, Greece, Bulgaria, Italy, Ireland. At least 8 countries are covered by the EU initiative. So of the EU, we say the EU is actually taking initiative in this area. This is exactly what we're talking about, how to act with an important impact going down to the level of the local communities, districts of cities. So one day we talk about mental health, depression in Europe. We quote European Commission, World Health Organization. We talk about the municipal office where the method is being promoted. And by doing that, they offer a blueprint for the activities of other communities. For example, by using I Fight Depression tool. So it's important to see this leadership setting the domino effect in motion. The ripple effect is certainly there. Then there is APS, the Academy of Special Pedagogy. We are going to have panelists representing this important institution, and I would like to wholeheartly invite you to participate in the sessions to follow. Well, thank you much. Let's give a big hand of applause to Piotr. Now, all together now, principle seems to be working, and we are certainly going to be using it later on. Channel 1 is Polish, Channel 2 is English for you to use. Now I'm going to disappear from this stage for a while, because Madam Olga Pilarska-Sinicka will read out a letter written by the Mayor of Warsaw, Mr. Trzaskowski, and then the letter will be followed by the presentation to be delivered by Madam Pilarska-Sinicka. Very good morning to you, ladies and gentlemen. It is my great honor today to welcome you, not just on my own behalf, but primarily on behalf of Mr. Rafał Trzaskowski, Mayor of the city of Warsaw, who, due to his other commitments today, cannot, unfortunately, take part in this important meeting with you. Nevertheless, he's written a letter which I'll take the liberty of reading to you now. Ladies and gentlemen, dear participants and guests of the conference, thank you very much for the invitation extending to me. This is an important event, Warsaw Against Depression, important not just to the medical milieu, but to the community of Warsaw as such. Fortunately, I cannot be with you today in person. I very much hope, however, that this is going to be a very fruitful conference for all of you. Depression and other mental problems are no doubt important to many societies, including the population of our country and indeed the city. The time of pandemic, uncertainty, the war raging across the border, effectively mean that speaking up openly about mental problems should be a priority for all of us. Depression has become an important challenge of the time. Depression requires support from the community. Neglecting incoming signals oftentimes mean that those who need assistance are not getting it. And at the end of the day, understanding the condition of those in need is a precondition for the support to be extended, for them to seek support in the first place from psychologists or psychiatrists. Owing to the events like the one today, awareness is being raised amongst the Poles on depression, and this disease is less often treated as a taboo in the local communities, and the local communities are expected to be supportive, including the community of the city of Warsaw. A program is operated through the municipal health institutions to support those who suffer from mental disorders, both adolescents and adults. The conference of today is a good manifestation of our care for the mental well-being of the citizens of Warsaw. Please accept my warm greetings, all the participants, and a very fruitful debate. I also wish you a lot of success in your further actions for the benefit of the mental well-being of our inhabitants. I hope you're going to cherish all the best memories from Warsaw. Signed, Rafał Trzaskowski, the Mayor of the city of Warsaw.
That was a letter by the Mayor of Warsaw. And now for the difficult part. It's very stressful. I'm a little hoarse today, but that's partly because I too have been affected by depression. I spent 3 days with my friends, and from the time I got on the train until I got off the train, I spoke a lot, I laughed a lot, so it's not that I have a cold. I charged my batteries for the next few months, so as to be able to get through the difficult autumn and winter days. And that's my recommendation. Laugh whenever you can, laugh wherever you can, because it's the best possible prevention. And now for a few pieces of information about what the office of the City of Warsaw is doing to prevent depression. This is a number of measures that we're doing. Okay, I have to say this. These are measures that come from two parts. First, they're financed by the National Health Fund, and these services are provided by municipal organizations, clinics, and hospitals. But there's also a wealth of measures that are financed and carried out by the Warsaw authorities from their own budget. The office, it is my pleasure to represent the Office of Health Policy, the Office of Education and Social Projects. All our three offices, our three departments cooperate. We do, of course, act to support mental health, but there's also very many NGOs that support Warsaw residents in their fight against depression as well as other symptoms of mental illness. Now for a few details. What we have are resources. At the first referral level, we have 8 community psychological and care centers and psychotherapeutical centers. And I don't need to tell you that community medical care, community support, is a breakthrough in treating mental disorders. So we've moved away from inpatient treatment, where patients younger or older, and now patients younger or older can stay at home and benefit from, and Warsaw residents. This is a system that's in place nationwide, and this is a breakthrough when it comes to treating depression. These 8 centers, these 8 community psychological centers, provide services, provide counseling, diagnostics, individual and group psychotherapy, family sessions, visits, and counseling. This is provided in the districts of Białołęka, Śródmieście, Ursus, Wawerwola, Praga Południe. I suppose you're wondering why it's only these 8 districts, but this is just the beginning. It's growing. Every district has counseling centers that are not necessarily run by the city. The topic of my presentation is the activities of the City of Warsaw. City-run clinics have 26 counseling centers and day wards for adults, young adults, and children. These centers provide all forms of outpatient care and provide comprehensive treatment and support, treating anxiety, psychiatric rehabilitation. This, as I've said already, The purpose of of such centers is to be patient-oriented. It helps individuals cope with their condition, providing diagnosis, identifying the problem, and therapeutical intervention. City-run centers also have 24 centers for addiction therapy. Paloma mentioned alcohol addiction and how it interacts with depression. So alcoholism and depression, or depression and alcoholism, are often intermeshed, entwined. And the centers providing treatment, there is also offer concomitant treatment of the concomitant disease, namely depression. And more in the hospital in Wola and Bielany, while the European Union programs are being implemented, we are treating adults with mental conditions, mental disorders, and these are important spots on this map of Warsaw. It's not just these aren't the only hospitals that provide such services. In Warsaw, we also have other facilities that have wards or beds for this type of patient, and European Union funding has also been obtained for outpatient clinics, community centers for young people in the district of Ursus and the district of Wola. These are services, or access to these services is provided for young patients, and it's a different range of services than in the counseling centers, but depression is treated by psychiatrists, and there is also therapy provided. Two city-run facilities, the Wola Hospital and the Bielany Hospital, also reach out to adults. They have mental health centers providing emergency, outpatient, day and hospitalization, as well as community care for persons with mental disorders. However, it is close to the home in their neighborhood. And now for some numbers. Of course, I prefer, and I suppose as would all of you, I would prefer it that there was no demand for these services for treatment of either addiction or psychiatric problems, but the world around us being what it is, I suppose each and every one of us has bad days, and for some of us, this bad day leads to a whole series of bad days, and we end up not being able to cope. So we go up to a doctor for assistance, and we can hope that this assistance is provided to the people who ask for it. The numbers, and these are figures for last year, which are exact and complete. The National Health Fund, providing the Polish National Health Service, financing national health, 124,000 patients received treatment for mental disorders and addiction. the majority of services were outpatient, and this is a change for the better because it indicates that persons with mental problems, that their situation is changing. They are no longer mainly referred to hospitals, but they can benefit, they can get the care they need in their local community, which is important. And in nearly 45% of these patients were given treatment in city-run facilities. As the city of Warsaw, we are an important player, an important provider of treatment for mental disorders, including depression. Patients who received treatment in day wards in city-run facilities represented over 31% of the, and this shows that in community-based care, 53% of patients were treated in city-run facilities. Ladies and gentlemen, on behalf of myself and the Mayor of Warsaw and the Deputy Mayor of Warsaw, I would like to wish you a fruitful and good session. The City of Warsaw will continue to be involved in numerous projects, and we will be involved in best practices, because every effort to fight depression is worthwhile. I will be with you, and I'm very happy to be here today. Thank you very much.
Well, thank you very much, Madam Director. You are acting director of the department. I forgot to mention that on the outset. It seems we're moving in the all direction, all of us, as we just heard. Our next speaker is Ann Elsner, who is GAD coordinator in Germany, German Alliance Against Depression. May I ask you on stage, and give her a warm applause, please.
Hello to everyone, and thank you very much for the kind introduction, and also for the invitation to be here today and to learn about Warsaw Against Depression and to share experience and knowledge that we've gathered all around. My name is Anna Elsner. I'm here for the German Alliance Against Depression, and I'm the coordinator in the national office in Germany, and I would like to share some experience, knowledge and practice that we've made in the past years. Yeah, so we've already heard in the introductions about the different levels of this intervention, and I'd like to outline the interventions as a whole. So we're talking about this community-based 4-level intervention. And when it comes to depression, there are many factors that contribute to the diagnostic and the therapeutic deficits in the community. And it has been shown that community-based interventions that are acting with different measures are considered to be most effective in tackling these issues. So I will show you in this intervention with a goal to improve care for patients with depression and to do suicide prevention. So on the first level, we are training general practitioners and mental health care professionals on the topics of depression and suicidality. And we also give them information about I Fight Depression that we've already seen in the first presentation and that has been mentioned before, which is a guided web-based intervention tool that patients with depression can use. On the second level, we address the general public, so we do a depression awareness campaign, and this transports key messages that we've already heard today, like depression is a real illness, depression can affect everyone, and depression can be treated. And normally, when alliances against depression start their intervention activities, they start off with a kickoff, with a launching ceremony in order to start this depression awareness campaign in their community. On the third level, we train the community facilitators and gatekeepers in the community. So this is very specifically targeted as groups as, for example, caregivers, geriatric caregivers, teachers, police, pharmacists, or journalists. And on the fourth level, we have, of course, the patients, the high-risk groups for suicidality, and the relatives. So here we support and give information on the topics of depression, and we also promote the I Fight Depression tool to be used by patients. And of course, there's also on this level lots of self-help activities, as for example, self-help groups. So here you see the network of the German Alliance Against Depression. We have around 90 local alliances against depression that work with each other and that work locally in their community. And we promote the exchange and coordinate the activities of these local alliances in Germany. When it comes to the international level, we've already heard about a European Alliance Against Depression, which we are also a partner in. And as it was already said, there are 120 regions in the whole world where the four-level intervention is implemented. That is in many countries in Europe. We've heard of some of them. Of course, Poland is on the map, which we are very happy about. And then beyond Europe, there's also the implementation in Australia, New Zealand, and Canada. So what do we actually do in the National Coordination Center in the German Alliance Against Depression? We pursue a bottom-up approach. That means that interested cities and regions contact us in the National Coordination Center. And this is very important for the intervention to be sustainable and to be successfully implemented because it creates a strong feeling of ownership at the community level. And as the national coordination, we then support in the planning and implementation of the local campaign. That means we support in how to find partners and sponsors, that is the funding. We advise on how to structure and coordinate the activities on the different intervention levels. And we also support in the implementation of the PR activities. That means we have lots of materials that we provide and that can be adapted for every region. We also offer train-the-trainer workshops, where we have trainings for local trainers, which are mental health experts in the community, and who then can train the gatekeepers and community facilitators. We also organize regular meetings 2 or 3 times a year for the network in order to exchange experiences, discuss questions, give ideas, normally face-to-face, in the past years also sometimes online. And this really helps in connecting the different alliances and enable the networking. And then there's also the opportunity to cooperate in projects on the national level. So I'd like to give an impression of the depression awareness campaign. So as I already said, normally a public event a kickoff event is the start of the suicide preventive activities, and then many alliances also organize talks on different aspects of depression with experts. And I wanted to give an impression here on the different materials that we use. There's a variety of them. For example, we provide posters, roll-ups, leaflets, just like on the bottom right there, and that I've also seen here that are adapted for Warsaw. And of course, every regional alliance gets their own logo. And these materials can then be distributed in information booths that the regional alliances are typically present with at regional or local events and conferences. They also have web presences, of course, the local alliances. We have a homepage where they can be integrated, but they typically also have their own homepages, web pages, or social media accounts that they use in order to put forward the depression awareness campaign. And then there's, of course, also an exchange between the local alliances on ideas that they've had or on different layouts that they have developed. And that also leads to, for example, special campaigns, for example, like printing a key message on a regional bus. Then coming to the train the trainer approach, which is a part of the first and the third level of the intervention. We provide these workshops in order to train mental health experts from the community to become trainers for gatekeepers and community facilitators. And that means that we present the material that we have developed and that are specifically targeted to gatekeeper groups. For example, geriatric caregivers, for teachers, for police, and you see that it has all very specific aspects of depression that it tackles, and we provide this specific material. And we also talk in these workshops about methodological issues. For example, how can you best present the symptoms of depression in a training, or also how can you use role plays in your training, which has been shown to be very effective. And after this workshop, the local trainers can then use these packages and organize themselves in a very time and cost-efficient way their own training, their own workshop, and this helps to keep it like with a very small work, and at the same time we ensure the quality of our training concept. So towards the end, I'd like to share some lessons that we've learned in the many years of conducting these implementation activities and coordinating them. It has been shown that it's very beneficial to being simultaneously active on all 4 levels to implement all activities at the same time, because they do not only have added effects, these different measures, but they also have synergistic effects. So if you, for example, think of the launch ceremony, you can imagine that this will create media presence, the media will report on this. It may also facilitate the uptake and the visibility of the trainings that will be provided in the community for the gatekeepers. And people who are affected by depression will also increase their knowledge on depression, for example, on the symptoms and the treatment options. And this may help also to get down in the perceived depression stigma, which might help individuals affected by depression to then improve their help-seeking behavior. And also for GPs, it might be easier then to confront patients who mainly present with somatic symptoms with a mental illness. So it's very important to be sufficiently active on all 4 levels to benefit also from these synergistic effects. And then also, if you start locally, you might then transfer to other regions. I think this is also a subject for Warsaw. Once you've developed all the materials and implemented the activities in one place, there might be other regions who are interested in also implementing the intervention. So it's very beneficial to then create a network and to benefit from the experiences that have already been made in another region, and if possible also to have a national coordination to support this network. It's always important to work independently from the pharmaceutical industry. Antidepressants and pharmacotherapy play a big role in the treatment of depression and other mental illnesses, and we also always say this in our trainings. It's a big part of the intervention also to communicate about this. So in order to stay credible and to avoid conflicts of interest, it's always important that the pharmaceutical industry is not involved in the funding or in the conduction of the implementation. And last but not least, it's important to keep the borders, that means geographically and concerning the content. So to be visible and to be clearly identifiable, it's important to be defined, for example, by postal codes. And then when it comes to the content, it's really important to only focus on depression and not on other mental illnesses or even non-clinical aspects of health like well-being or stress, in order to be very identifiable and for the cause to be perceived and also to be effective in the intervention. So thank you very much for your attention. Thank you again for inviting us today, and please don't hesitate to contact me afterwards for questions or also via my contact details. Thank you very much.
Thank you, Anna. Ten moment, kiedy będziecie Państwo się mogli
And
sieciować już przed
the
nami,
timed network is coming up because the coffee break will provide an opportunity to ask questions, but there's a lot of information to share before the coffee break. Anna mentioned networking, mentioned connecting, but to network and connect you need knowledge. And now to present a report by the WHO, which also refers to the Polish context, let's have Olga Kahn from the WHO office in Poland.
Thank you very much. 1 second. It's a pleasure to be here. Thanks for inviting me. I'm representing Minister of Health. Sorry, and how should I click for the next slide? Okay. Yes, and I want to present you a World Mental Health Report, which was launched just recently. And I think it's a good occasion because World Mental Health Day, it's a day when we advocate and speak about mental health and normalize discussion about mental health in the world, in any place where you are. And when we speak about mental health, it's important to say that like everyone deserves for good mental health, everyone and everywhere. And it's an integration part between health and well-being. When we speak about mental health, we say about good connection, good function, and good well-being and life. 1 second. Sorry. Yes. Speaking about mental health, we still know that there are a lot of barriers in the world. Despite all the services exist, however, we know that, services exist, even sometimes they are available, but they can be inaccessible, unaffordable, they can be with a poor quality. Also, we know about low literacy and low awareness. So this day is a good example when we have to raise awareness and speak about mental health more and more. Also, we know about stigma and discrimination. In all countries around the world, a lot of people who are afraid to say about depression or any other common mental health disease and just don't seek for help. Already was mentioned before, but COVID time and all years in isolation bring a hard attention on mental health. People who overcome or just have been in isolation and feel bad about this. Also, Paloma mentioned the war, and all these events affect not only Ukraine but all other countries who also receive refugees. Poland, one of the countries who receives the biggest number of Ukrainian refugees, and we have to be aware these people are left their homes, lost some of relations, they lost some of them, their friends or family members. They are lack of security and lack of certainty about their lives. All these factors brings mental health issues to their life. So speaking about mental health, we have to keep in mind key groups, vulnerable groups who needs more special attention. A little bit about epidemiology. We know that around the world, 1 in 8 persons suffer from one or another mental health condition. Mainly, slightly more women than men suffer from mental health. Speaking about depression, we also keep in mind the highest risk of suicide for people who have depression. So we pay a lot of attention to suicide, and we know that 1 in 100 deaths happens in the world happens because of suicide. And we know that average age for people who do suicide is around 50 years. So basically these people could live, continue to work, bring value in their life and life to their families, but they did a suicide. Also, speaking about gaps, we identify a few key gaps which exist around the world. They also, in more or less, exist in Poland as well. Gap of information. We know that only 50-60% of countries who have relevant, accurate, adequate data about epidemiology, prevalence of mental health condition in their country. About Poland, we're still waiting for the recent data. Some exist, some is still not. So we use estimations and triangulations. Governance gap. We know very common situation when people who suffer from mental health conditions and who need support have to wait in the queue for a few months to get admission with doctor. So governance, HR, staffing in psychiatrical clinical hospitals really need to be addressed. Resource gap. And basically information and knowledge information should be improved as well. And service gap, I already mentioned that people we really need look and reshift our attention how to address mental health in terms of HR and where these services can be addressed. I will speak about this further. A little bit about finance, because if we want to improve system, we need to know how much it costs. So there is a good research. Investing $1 in evidence-based interventions such as CBT or, well, basically evidence-based intervention can bring back $2 back, and also it can save 5,000 years lived with disabilities on 1 million population. It's huge. Competences, it's already have been tackled with the previous presentation, and speaking about support for people with mental health, we should not keep our attention and concentrate our attention only on psychiatrists. This reform is ongoing globally, and Poland, one of the countries who already started reform on mental health, and there are community mental health centers where services provided not only on tertiary specialized level on psychiatric hospitals, but also in community hospitals. All the needs can be addressed on all levels of pyramid, starting from community, primary health care, general hospitals, and only after on psychiatrical level. Very often, you probably heard before, we told there is no health without mental health. But mental health, it's not only health. We have to think and address these needs in a multi-sectoral approach. We should pay attention to mental health in the school, in the community level, on sport activities, and other relevant in employment centers, and other relevant conditions when we can speak about mental health and pay attention to people who can suffer from depression or any other common mental health diseases. As I mentioned, suicide prevention is an important topic, basically 22% of countries in the European region have national plan on suicide prevention. Poland, one of them. You do have a plan. Ministry of Health and Institute of Psychiatry and Neurology hard work on implementation of this plan and realize different tasks. And in the past decade, last 10 years, suicide rate decreased on 16%. So basically all this coherent action do have results. One second. Yeah, I forgot to mention that Ministry of Health work on this on suicide prevention, and they do work on translation-based guidance and best practices from WHO and other partners. Also, mental health and workforce is an important. When you, after this meeting, each of you will go back to your offices, I encourage you to think about do you have a job description with clear task which you have to do? Do you have a work-life balance? Do you keep it or not? Do you encourage your colleagues keep work-life balance? So work is an 80% time of our life is spent in the office, so it's important to keep attention to mental health in the office for everyone. Yeah, it's a little bit continuation about multi-sectoral approach and mix of services. As I mentioned, all countries around the world going forward to the reform of reshifting mental health from tertiary level to lower layers, and address mental health can be done on different layers, on community mental health, where people are living, on general health, where people come to general practitioners or other doctors, where comorbidity can be addressed as well. Sorry. Yes, this slide is about community-based approach, and Poland, as I mentioned, already started a movement into this direction. Just last week we were on the conference about the institutionalization, and colleague from Ministry of Health mentioned that they started this reform from February. For now, they have 50 community mental health centers around Poland. Until the end of the year, they have a plan to have 80 community mental health centers, which means people less stigma, better access, and people can get services and address their needs and problems about mental health close to their home. Yeah, integrated services, and I already a little bit mentioned, and Paloma already mentioned that WHO support Ministry of Health, and we are going to provide trainings for doctors, general practitioners on the primary healthcare level, and we will do a training on MH gap, and it's really very correlate with information our colleague from Germany already mentioned, so which means we all work together in the right direction, and the doctors from the primary healthcare level will be equipped with a good knowledge and skills how to talk with people who come with I don't know, hypertension or diabetes, but that means doctor will have skills and knowledge how to address and to see the signals about depression or any other things. Yes, just summarizing this slide, I want to say that it's great that we meet here, that we have I'm really grateful for colleagues from European Commission, for mayors, that they keep attention to topic of mental health. But beyond this, each of us can do something. All of us playing roles in our life, mother, sister, colleague, friend, etc. So basically, we should not put all their responsibilities on mayors or government or someone else. Each of us can play a role and see when you go back to school to pick up your kids, just to check about situation with bullying in this in the school or violence within the kids. You can go to office and check how is your colleagues and ask how are you if you see someone tired constantly. Yeah, you can check does your family doctor is trained on MHGAP or any other related trainings in terms of mental health and so on and so on. So basically, just think widely about mental health, what you can do and how you can support this area. Yes, and this is the last slide where we speak about really basic principles that mental health services can be done on different levels, not only psychiatric, but also in community. That on any level we are deliver our services. First of all, we have to think about quality rights and human rights and so on. Thanks for attention.
Uzupełnimy ten obraz o coś,
Okay,
co
thank you very
parę
much.
razy
We
się
will
pojawiało
now
w
fill in
scenie.
this picture with something that's been mentioned a number of times already. The speakers mentioned the situation in Poland, Ukraine. We have an increasing, growing numbers of Ukrainians who require support with mental health, so I'm sure that you will be interested to listen to the presentation by Sanem Ozen from the UNHCR, who will tell us about mental health support for refugees.
The green one. Okay. Hi. Thank you, everyone. So first of all, I would like to thank everyone for organizing this platform because it is very important in the World Mental Health Day to come together as different bodies that can influence responses that can actually make differences in our own communities. So, as mentioned, you have heard a lot about different layers of services, what we could do. So I would like to take your attention to community engagement for a minute. Okay. Why community engagement is important? Initially, it's very important not just for refugees, but also for all communities, yeah? Anyone that is facing difficulty in their lives, they should not be seen as victims to something, yeah? They should be empowered to actually feed into their own treatments, to feed into their own well-being, so to say. So it's very important that we engage, even if they are patients themselves, which we will talk about a modality actually that is part of the mental health reform in Poland in further on slides. But it is very important to see and empower communities within the responses that we try to build and we try to create. Everything starts with community engagement, and I would like to emphasize 3 different layers that we can do community engagement. One, it starts with informing decision by the communities. Second, we have building capacity, and thirdly, we have strengthening relationships. What do we mean by informing decisions? So basically, informing decisions, as it was pointed out, that communities feed into policies, into mental health reformations, into what is better for the community. And it's very important that we listen to communities themselves, whether it's refugees, whether it's host communities, whether it's changing and shifting dynamics within the communities. It's very important to listen to all different aspects. Way that we can do this is engaging with communities, one-on-one engagements, focus group discussions, sitting, as it was mentioned earlier, to create policies together with communities. Yeah? And as mayors, this is something that you actually can have a large impact in. Yeah? Just taking the time to actually go to the community. Yeah? Moving on to good practices in capacity building. It was mentioned by Anne from German Alliance, trainings that could be done for communities, not just as TOTs, but also to make them start responding to challenges within their own communities. It's very important to engage, especially to overcome depression. We talk about why community engagement, how does it help? It's not only empowering communities, but also it's empowering them to be able to respond as a preventative measure so that people do not develop further mental health disorders. This is very important to consider as a preventative measure as well, because most of us start with very small things, and then it builds up, builds up, builds up over time. So it becomes very difficult for us to overcome until we await, sometimes to reach out to more specialized services, yeah? So it's very important to equip everyone in community, whether it's our neighbors, whether it's our mothers, teachers, social workers, and other community members within our scopes. Some of the scalable, so this goes to what Olga, our colleague Olga was mentioning about evidence-based, investing into evidence-based modules, yeah? And you see some of them up in the screen. Obviously, these are not limited to just these three. There is much more that was mentioned by multiple colleagues. Moving on to strengthening relationships. How do we strengthen relationships within the communities? What does it even mean, strengthening relationships? Yeah? As it was noted, there is a big influx, and Poland has been tremendously generous to host impressive number of refugees. But this causes changing dynamics within our communities. And I'm sure most of you within your own communities have seen this, have acknowledged the existing of shifting dynamics. So it's important to bring everybody together to create new communities, to support them, feel like they are communities again. And it is not necessarily about refugee communities. It's not about Polish communities. It's about bringing everyone together so that we have a coherent, happy, feeds our well-being environment that is created not just for us, but also for our future generations. So it's very important to actually focus on forming these communities. And also another way we can do this is to create safe space, for expression. And as I mentioned earlier, sometimes it's not easy to go to a psychiatrist. It's not easy to go through the healthcare system. And this is partially because there sometimes is not as easily accessible. It takes time. And sometimes it's the stigma that's attached to it, yeah? And it's one thing we do have to acknowledge. So it's very important that we train other human resources, that we integrate mental health and psychosocial support into other areas of work. Like teachers, we can train teachers on very basic modules. We can train social workers in very basic modules. We can train ourselves in very basic modules to be able to acknowledge when people are facing challenges, to empower ourselves as well as our communities within this. So it's very important to take a moment to think about what we can do as mayors, what we can do as teachers, what we can do as students, yeah? And through community engagement, what do we achieve? As I mentioned, one of the questions we always and continuously ask to ourselves, why community engagement? I want to point out, most importantly, we decrease the likelihood of further mental health challenges from developing. So it is a preventative measure. I know I keep on repeating this, but it is a very important factor. It's been mentioned in refugees, 22%. In Poland, there is over 30% of need in mental health, of people that are struggling and facing mental health disorders. But we can help to decrease this as we progress further. It's about identifying it earlier. It's about having a preventative measure embedded in the community where people feel a bit safer to access these services. And secondly, it increases ownership. The more we engage community, the more ownership they have of policies, of structures that are being designed, of even the spaces that are being formed as we move forward into more community-led and community-based servicing. Secondly, we have, sometimes, especially for those that have faced emergency and have shifted countries, it is important sometimes for us to gain a new purpose in life, yeah? Because as it was mentioned, you know, we're teachers, we're mothers, we're social workers, we're psychologists, we're many different things, but when we shift countries, we lose that communication and connection we have to how we describe ourselves. So it's very important. And sometimes these basic modules, training community members gives them a whole new outlook in life, whole new purpose in life. And this is where I would like to mention what is being done under the mental health reform in Poland. There is a project, part of the mental health reform engages a foundation called Open Dialogue. And basically what they do is train mental health patients that are in recovery themselves to become recovery agents. So they actually become part of the response. And we had the pleasure of hearing them out a couple of weeks ago in a conference. And the way that they express how they felt just by being part of this response, just by being engaged with and supporting other mental health patients through their journey of recovery was so powerful. I think all of us need to think what we can do further for it. And it really did give them another meaning, another purpose in their lives. So it's important to acknowledge these. And last but not least, it is cost efficient, it creates sustainable and low-cost services to be provided. Because once you do the trainings, you really don't need a lot of money to sustain these, as they are led by communities for the communities themselves. Thank you so much.
Sanem, you leave your phone. It can be useful. Drodzy Państwo,
Ladies and gentlemen, we've heard a number of very interesting presentations. I'm sure you'd like to be able to talk about them, discuss them. And it fortunately so happens that we have a 20-minute coffee break as scheduled now. You can come up to our panelists, and those of you following us online, you can make yourself a cup of coffee, but you can also send in a comment or a question. This will be your chance to take part in this meeting, to make your voice heard. After the break, we'll have an important presentation about autism and depression and a debate on support for individuals, as well as the signing ceremony of the declaration. So see you all in 20 minutes.
Dobrze, czy już? Ja jeszcze tam widzę jakichś pojedynczych gości, ale mam nadzieję, że Państwo zaraz do nas wrócicie. Udało nam się odzyskać widok w kamerach, co znaczy, że udało nam się wrócić do naszej publiczności w mediach społecznościowych. I mam nadzieję, że Państwo też już wróciliście z kawką. Zapraszam. Niektórych wyganiam na przykład, żebyśmy mogli zacząć. Wspaniale.
And let's resume.
Ta cała część, tak jak mówiliśmy w przerwie, będzie w
As
języku
we
polskim,
said,
więc
this
tłumaczenie na
session will
angielski
be in
jak
Polish.
najbardziej trwa. Tłumaczenia na
Translation
polski już
is
ze
provided
zrozumiałych
into
powodów nie
English,
będzie.
and there will be
Bardzo
no
się cieszę,
more
że Państwo nie
translation into
uciekliście,
Polish.
zostaliście, bo przed
I'm
nami
very
jeszcze
glad that
sporo
you've all
ważnych
stayed with
tutaj
us
i
because we
rozmów,
have
i
a lot of
gestów,
important
i
things to
zdarzeń. I
say,
mam
a lot
nadzieję,
of
że
things
będziecie
to
brali w
do, a
tym z
lot
nami
of
udział do
events.
końca. Cieszę się,
And
że
I hope
wróciliście
you will
Państwo
stay with
do
us.
mediów społecznościowych.
I'm
Bardzo
glad
miło Was witać po przerwie.
you're back with us on
Pierwsza
social
prezentacja
media.
po tej
Welcome
przerwie, bo
back
już
after the
zaczynamy,
break.
już koniec mojego
The
zagadywania.
first
To jest
presentation
prezentacja, o
after
której
the
muszę
break
powiedzieć,
is
że dla mnie
a
osobiście
presentation that
jest
I
bardzo
personally
ważna.
am very much looking forward
Opowiadanie
to.
dzisiaj o
It's
grupach
important.
wykluczonych
We're
było
talking
jednym
about,
z ważnych
we mentioned
momentów. W grupach wykluczonych,
excluded,
grupach zagrożonych depresją
marginalized,
szczególnie, w
vulnerable
inny sposób,
groups that are at risk of depression. We had a very interesting presentation about refugees, about how we as local communities can cooperate and to
Historia
help.
pani Danuty i pana
The story
Macieja,
of
który za chwilę przed
Danuta
państwem
and
wystąpi, to
Maciej,
historia,
who
która
will
kilka
be
lat temu
joining us on stage in a
obiegła całą
moment,
Polskę i
is a
właściwie od lat
story
jesteście
that
państwo bohaterami. Pani Danuta
for
na
several
scenie się
years
pojawi wprowadzając pana
ago
doktora
was
Macieja Oksztulskiego
famous
z jego
around the
prezentacją na
country.
temat spektrum
Danuta
autyzmu.
will give us an
Powodzenia.
introduction, and
Brawa,
Dr. Maciej Oksztulski will deliver a presentation on the autism spectrum condition. Hello and welcome. Thank you for coming here. Thank you for noticing the autism spectrum. I recall
Przypomniałam sobie taką sytuację,
there's a situation I remember. This
wcale
will
nie
be
było.
told
Był
as
taki
a
okres,
success
że
story,
Maciek
but it wasn't
miał
all
próbę samobójczą
rosy.
w
There
wieku
was a
prawie
time
19
at
lat.
the age of
Jeżeli
19
będzie to
when
Państwa
Maciej
interesować, to
had
bardzo
a
proszę. Ja
suicide
to
attempt.
przypomniałam,
If
to był
you're
naprawdę tragiczny
interested,
okres w
again,
naszym
it was
życiu.
a very difficult time in our life. Good afternoon. My name is Maciej Oksztulski. I'm a non-verbal person with autism spectrum condition, with substantial disability, but I'm also a doctor of law at the and European law at the University of Białystok and a data analyst in Europe Direct. I have a speech synthesizer and a personal advisor, namely my mother, Danuta Oksztulska. Yes, I am a nonverbal person on the autism spectrum. You can't hide it. Persons unfamiliar with the spectrum should learn about the problem for our benefit and theirs. Autism is a neurological condition. It's a developmental condition. It's very complex, and the origins are unknown. People differ in terms of the severity of their condition. Scientific research has shown that despite similarities between persons on the autism spectrum, there are many differences. Social impairment of social interaction, verbal and nonverbal communication, as well as limited interests and social activity. These symptoms occur in early childhood and to a larger or lesser extent last a lifetime. Early diagnosis is necessary and intense rehabilitation. I was diagnosed as autistic at the age of 4. At the time, it turned out that in the city of Białystok there were no specialists trained in helping. I found a center give persons with a mental disability a chance. Originally, these visits were to take place once a month. Then the next stage was preschool. The motto, the slogan of integration does not apply to persons on the autism spectrum. They're all afraid of us. Looking at the support system for autistic persons, my mother, along with other desperate parents, took matters into her own hands. The first step was to force local authorities to enroll me in an integration preschool. I only spent 4 hours a day because of behavior. I was there between ages 5 and 7. My mother didn't want me to go to a special school. 2 years late, I enrolled in first grade for 2 weeks. I won't go on about how a place in this class, how difficult it was to find a place. It's difficult, and nobody wants us. I was an autistic person. I was nonverbal with hyperactivity. But I was happy. I was fortunate. 2 weeks later, I was referred to individual classes 4 hours a week. The regulations say that the students can have between 4 and 6 hours of classes a week, and there's no way around that regulation. In Białystok, everybody is given the lower limit, so 4 hours. Sometimes my mother and I, who also bought me dance classes, she had to dance with me because none of my school mates, my girls in my class, wanted to dance with me. Parents of autistic children established a section in Białystok, which led to the creation of a center for autistic children. I didn't stay there as an inpatient, although I did benefit from counseling. In the year 2000, the project enabled me to get therapy at the center, facilitated communication, and was introduced. It turned out that my intellect was above the norm, so I was promoted to 4th grade from 1st grade. Then I moved on to middle school and secondary school. There was a lot that was achieved. Communication changed my life. People started understanding me. I was no longer aggressive, and self-aggression also. I slept all night and life was better. Only trilateral cooperation between myself, my family, and the university led me to where I am now. Maciej Okrztulski, aged 31, am now a doctor of law and a researcher at the University of Białystok. This was possible thanks to the support of my tutor and mentor, Professor Maciej Perkowski, the head of the Department of International and Public Law at Białystok University. I could say a lot about him. I will only mention that as part of this project, I spent a week in the United States. We were guests at Syracuse, the College of Law, and the School of Education. Our counselor, our tutor, was Professor Michael Schwartz, who was the disability. He is deaf and works with a sign language interpreter. I met specialists working with the students on the autism spectrum, including a specialist for facilitated communication who heads the Institute of Communication and Integration at the university. At the time, there were 34 students with autism at the University of Syracuse. The best-known graduate is President Biden. The Americans were interested in our methods, and we began cooperating, and we cooperate to this day. On November 20th, 2020, I received a fellowship from the fellowship program, the legal status of persons with autism in the workplace, domestically and internationally. I established and full access to the labor market for persons with autism requires dedicated legal solutions to finance and implement forms of support for persons with autism in the workplace. Persons on the autism spectrum need conditions to work that will allow them to function in society, and the costs are much lower than the costs of treatment, therapy, social welfare. The approach of local authorities and national authorities will make it easier for persons on the autism spectrum and serve to build a democratic society. The findings of my project under the grant can be used for teaching purposes, which is being done when teaching international public law at the University of Białystok for persons with disabilities and their enjoyment of the right to education. This has become part of the syllabus, and there are theses being written on this subject, which I find very gratifying. Using this is a part of another project which I'm involved in, the effect of fundamental legal research on the legal profession, financed by a grant from the Opus program. The purpose of the program is to expand and systematize know-how about fundamental research and how it affects legal studies in the 21st century. The findings will make it possible to determine how fundamental legal research affect and how it affects also selected European countries. By collating the findings with the doctrine, and I'm inspired by the originality and uniqueness of this research, which I find very rewarding. From May 1st, 2021, as I am a data analyst responsible for selecting material or the case law of the European Court of Justice, translating into Polish and initial pre-editing. This is also greatly rewarding. Inability to convey my thoughts, communicate my thoughts verbally, orally, did not impede my academic research, and I suppose few expected this of me. Thanks to the effort of my family, the support of the university, and allies, I have managed to achieve a lot more than I have ever dreamed of. 20 years ago, nobody even dreamed that a nonverbal person on the autism spectrum would be a jurist. My difference, I am different, but all these, I am a researcher. I am not a lecturer, so I do not teach classes. This is a rational approach, not because students would need would need preparation to work with an academic instructor. This is not being provided at the moment. Professionally, I've been witnessing improvement and better understanding of persons on the autism spectrum, which makes it possible for persons on the spectrum to find a place in society and use their education to leverage their strengths on the market. The number of persons with autism is going up. We need resolve and we need to have hope. A lack of long-term solutions for persons with ASD mean that despite, even though the situation is better, as a self-advocate, I, however, feel validated and I have dreams. One dream of mine would be to be independent, at least to some degree. I know that if I pursue my career, this will serve my rehabilitation and socialization. I can't forget that my parents are getting older, especially as assisted housing for persons with autism is not very available. I will not share my deepest, my most personal dreams, but those are the dreams that I could share. To summarize, the best antidepressant is talking to smart, intelligent, and good people, working and having dreams that are based on feasible foundations. Thank you for your attention. Your attention was a great help as well. Thank you.
Te wielkie brawa są jak najbardziej zasłużone. Państwu
Well, the big applause is
pan
certainly
Maciej będzie odpowiadał na wasze pytania.
deserved.
Tam z tyłu za chwilę zostanie
We will have
Maciej
Maciej Chrztulski with us. He'll be able to answer your questions. We have a synthesizer in the back of the room, so you will be able to put questions to him and he will reply. There is an opportunity for this today. It's worth taking advantage of it.
Świadomej młodzieży w Łodzi, Kutnie i Kowalu, bo pan Maciej daje przykład innym
Mr. Maciej sets an example for other persons within the spectrum as someone who is able to achieve his plans and dreams maybe, so yes, questions will be made possible.
Jak państwo zauważyliście w tej prezentacji,
Well,
pan doktor starał się państwu
may have
opowiedzieć
noticed,
nieco bardzo skrótowo
Dr.
o tym, jak osoby w
Chrztulski
spektrum mogą się rozwijać, ale
told
też
us
z jakimi
about how
trudnościami się spotykają.
persons
To
in
właśnie
the
te trudności
spectrum
sprawiają, że są w
can
grupie osób
grow
szczególnie narażonych
and
na
what
depresję.
difficulties they
W
run
prezentacji
into.
widzieliście państwo, że to jedna z
You
najczęściej
could see
dotykających ich chorób.
in the
To,
presentation
czy będą spotykali tych mądrych, życzliwych ludzi, o których mówił
what
pan
he
doktor,
identified
zależy również
as
od nas, od
extremely
naszego
important, whether they will have a
zaangażowania.
chance
I
to
głęboko wierzę
meet
również od tych lokalnych aliansów,
wise
o których dzisiaj
people.
mówimy,
And
bo
I
im większa
certainly
i pełniejsza
believe
będzie nasza
that such
wiedza nie
encounters
tylko
will be
na temat
made
depresji,
possible
ale
through
właśnie
the
również funkcjonowania
local
spektrum autyzmu,
alliances.
tym więcej
We are
dobrego
not
razem
talking
będziemy mogli
about
zrobić. I
just
myślę, że będzie to
depression
jeden z
today.
wątków, który już za moment poruszymy w
the,
debacie, do której serdecznie chciałabym zaprosić
autism
moich
spectrum
panelistów,
is an equally
pana doktora
important topic,
Balickiego z Polskiego Towarzystwa
During the discussion session, Dr. Marek Balicki, Polish Society of Community
moje, wszystkie
Psychiatry.
inne, panie doktorze, do wyboru.
You can choose your seat,
Pani doktor Joanna
doctor.
Krzyżanowska-Zbudzka, Instytut
Dr.
Psychiatrii i
Joanna
Neurologii, Sekcja
Krzyżanowska-Zbudzka,
Psychiatrii
Institute of
Środowiskowej i
Psychiatry,
Rehabilitacji PTP. Wielkie
Neurology and
brawa.
Community Psychiatry.
Ja przejmę to w takim układzie. Dobrze, pani doktor jest z nami. Jest z nami Angelika Friedrich, autorka twórczyni Nastoletniego Azylu.
a
Brawo.
Teenage Asylum.
Takim pięknym, radosnym krokiem, czy równie radosnym krokiem wejdzie na scenę Szymon Majewski.
Very joyful gate we just saw. Szymon Majewski, will you equal the joyful gate?
Jest to dobry,
Yes,
radosny krok.
it is a joyful gait
Ja też usiądę, pozwolą
performed
państwo.
by Szymon. Now, I'll hand over the microphone to you, Doctor.
Pozwolą państwo, że zacznę od pytań, w których chciałabym nawiązać do tej
Now, allow me to
prezentacji
start
przed momentem,
from
bo
the
pojawiał się
questions
tutaj wątek
which were
edukacji.
prompted by
Pan
the
Maciej
previous
dzielił się
presentation.
doświadczeniami do tego trudu włączania. Panie doktorze,
Maciej
czy
talked
polscy
about
lekarze
the
są
difficulties
gotowi
in
na pracę?
engagement.
Mają
Now, are the
psychiatrzy,
Polish
mają wiedzę na
doctors,
temat tego, jak pracować
psychiatrists,
z osobami z spektrum
equipped with knowledge on how to work with persons in the spectrum?
Dobre pytanie, muszę powiedzieć.
Nie
Well,
ma być
I
łatwo od
must
początku.
say it is a good question. Well, it cannot be too easy to warm us up. Now,
I znaczna część
it varies, and a significant number of doctors and psychiatrists do have the knowledge and expertise, but a lot remains to be done.
przeskoczę od razu z tego pytania na tę myśl przewodnią dzisiejszej konferencji. Przynajmniej tak ja to odbieram.
Allow me to refer to the leitmotif of our meeting today, and that is the community, the local community.
Inicjatywa w różnych obszarach demokracji.
Think local in the 1990s in Poland, when the civic society was taking off. We would say, think globally, act locally. And I think this motto,
Organizować wiele z tych działań, ale
although
społeczność jest miejscem, gdzie można prowadzić na tych
maybe not fully so in the
okazji
autistic spectrum, but certainly many activities related to it can be organized in the local community, the four pillars mentioned today.
funkcjonalnego, tego co
Functional integration is one of such activities, what the healthcare system is doing today, what the schools are doing today, what the local authorities are doing today too. All that is happening on the local community level. Now, how to engage doctors, general practitioners, and psychiatrists? I think the primary healthcare is a key to the solution and a key to entry, it's an entry point to the healthcare system. One family doctor per 20 to 2,500 inhabitants, by the way. This is where we should be active in order to make up for certain leeways that are found there in terms of experience and expertise. We could certainly train the doctors to run screening techniques to identify issues related to spectrum of autism.
do tego, żeby nie było, bo to co było ważne w tej prezentacji, że ta rzeczywistość wygląda tak różowo, jak
Now, as we heard a moment ago, the reality is not all that rosy,
inna niż jeszcze niestety nierzadko ona jest.
and a lot remains to be done.
Które usłyszeliśmy tutaj na początku tej konferencji.
Well,
było
one of
zdanie
the first
profesora
sentences
Krystyny
that we
Jandy,
had
tej prezentacji,
was
która
actually read
była na
out by
początku.
Krystyna
I tam było
Janda.
pytanie, że 3 na 4 osoby doświadczające
Now,
depresji
3
nie
out of
otrzymują
4
właściwej
persons
pomocy.
affected
I pani
by
doktor
depression
Zydrowna
do
Wina,
not
która sprawia, że
receive
to jest dokładnie
adequate
pytanie, pani doktor, dlaczego tak się
assistance.
dzieje? I co te
Why
lokalne
is it so,
działania, takie jak
doctor?
nasze dzisiejsze,
And
mogą w tym zmienić?
what can local actions do to improve the situation?
Dlaczego 3 na 4 osoby nie
Well, why
bardzo wiele?
3 out of 4 do not receive assistance? Well, there are many reasons behind that. One is a set of systemic reasons, considerations. Accessibility to the healthcare system is still very weak in Poland. Those areas that are not covered by the pilot activities under the healthcare reform, you need to wait a few months for specialized medical consultation. So this is the first difficulty. Even if you are aware that you do need help, it's not all that easy to receive it. Or if you take a primary care doctor who might want to be of assistance and prescribe a medication, now that will not be refunded. So this is a deterrent, really. In a big city like Warsaw, where there are a number of vacancies for doctors in public healthcare, and conversely, in the private medical sector, there are no such vacancies. For children and adolescents, yes, you need to wait, but it's easier to receive specialized attention. So one of the first reasons I would identify is limited accessibility. Now, a second reason, equally important, is stigma or even self-stigma visible in this process. Whether we are fully aware of it or not, we do stigmatize such minority groups, and as regards the stigma attached to mental disorders, well, this may not be all that visible, because with motor disabilities, it's visible, you can see such impairments, but for persons affected by mental impairments, well, there is a certain stereotype about a mentally ill person, that such persons may be dangerous and unpredictable. And if people are treated accordingly, then they embark on a self-stigmatization process. There must be something wrong with me. I'm not as good as all the others around me. And that is an extremely dangerous phenomenon, because it oftentimes marks a delay in seeking assistance. The longer you walk around carrying your symptoms uncured, the more difficult it is to cure them. So people suffering from depression and other disorders as well do not receive treatment. This is a handful of considerations from me. Well, the stigma you mentioned, I think we are faring better and better there. We are trying not to succumb to stereotypes. And by the way, you will have a chance to put your questions, ladies and gentlemen, both those of you who are present here in person and online. But allow us to continue for the time being. You mentioned a stigma. Shimon, let me address this question to you. When you shared your experience of mental health crises, my impression was that you were fighting more with yourself than being afraid of the reactions of others. I would not be that brave, was it not for Justyna Kowalczyk, who effected a breakthrough, the famous interview in the Gazeta Wyborcza Daily more than 10 years back, when she was receiving all the prizes and rewards. Justyna Kowalczyk could not sleep at night, would take sedatives, and then she would wake up early in the morning and win the race. So I had this internal block in me. I thought that might be a bit of a feat of exhibitionism, perhaps, if I were to speak out loud about that. At that time, I was already past my second crisis. Then I started to talk about it. I made my confession in an interview, but again, it was motivated by Justyna Kowalczyk. I remember when I was 18, as was the old days of the communist system in Poland. My mother would not understand what was happening to me. I did not understand that either. And yet, my uncle was a psychiatrist, and he started to support my mother. I remember I started attending psychotherapy. I was to keep it, under my hat, hush hush. Don't talk about that. My mother would tell me there were two things I should not be speaking out loud about. One is psychotherapy I was attending, and that our father left us. That my father had left us. Remember, your daddy is working on a contract in Iraq. And then, obviously, I was seeing other doctors too, but that one doctor, psychiatrist, I was not allowed to speak out loud about. And then my celebrity career, myself, and the panache over me, and the hairdos, and so on and so forth. So I was the one who was offering a big smile to the whole world. Children would call me Pan Fajnek, Mr. Nice. How could I say that bad things were going on inside me? Well, Mr. Nice has it the hard way, because if you are constantly happy-go-lucky, then what possibly can go wrong with you? Were you confronted with such reactions? Yes, I remember one of the more interesting experiences I had was in a taxi, where an overzealous taxi driver was taking me somewhere, and he would actually tax me with his eyesight, so to speak, and he would call me Mr. Smalling. He is someone to look at. This smile he has. I keep saying this to my family. That's the way you need to be. Go through your life with this kind of panache. So I looked at my watch and I thought to myself, well, how much time have I got? If I have 2 minutes to write, I will not be able to explain. I'll just confirm, yes, I'm fine, thank you. But there was a bit of a traffic jam there, so we needed longer to drive, and I did explain it to him. I said, it's not all that rosy. There are shadows behind my profession too. It's not all that Mr. Perfect. And I think in the end of the day, that perhaps reinforced him somehow. Krystyna Janda told me that when you forget your lines, do admit it. I forgot what I was going to say. People do not want to see people made of bronze as monuments. Yes, you're coming out regarding mental health. In your case, you were a teenager. You made an appearance on the YouTube channel. You talked about your depression. You do not quite know at the time where that would lead you, but yet you did say what made you forge a success out of the misery you are in. And now there is the teenage activity organization you're running as a psychology student in the third year. I do not expect that to be participating in a conference like this one or the TVN 24 television. Yes, I came out when I was 17 and started talking. I am now fulfilling the dreams of a little girl in the junior high school who wanted to be good, who wanted to act good, who wanted to fulfill her dreams. I was engaged in many charitable activities, and it turned out in the end of the day that I was best in offering this face-to-face direct assistance. Therefore, I went for psychology. I'm studying it now. I want to become a psychotherapist. But at this stage already, I am doing many things. I started off when I was 14, giving support to other people. We are not lone islands. We are surrounded by people. I am surrounded by people who are there for me, and I know crises happen. I presume a number of them lie ahead of me. We're only humans, that's what happens to us, but owing to the local community, to the support of the nearest and dearest, I know I'm able to survive any crisis that may come, and I understood that in the activities I was providing for others. Now, this mental health coming out is not always possible for everyone. There are still many places, too many places, where that would trigger off a stigma, comments, deficiency in support which is needed. But today we're talking about good practices, so why don't we elaborate on that? What good has flown out of your coming out of your sharing?
Frankly, as a 17-year-old, I didn't know what it would lead to. But if I had known, I suppose I would have done it again. Although at the beginning it was difficult, in the beginning it was hard, and my family, it was a secret. The fact that I attended psychotherapy, only my mom and dad knew that I was seeing a therapist. The rest of the family might have suspected something. I was sad. My mood was low. My weight went up and down. I had an eating disorder. They didn't. I don't think they really knew. I suppose my parents were afraid that they would be blamed. But when I did come out, when it was out in the open, when I even told my school, in high school, nobody really knew because I kept it a secret. I didn't, but then I felt relief. I felt at peace because I knew that I can talk about it. If I said it, I would get support. And I knew that maybe my friends, the people around me, wouldn't judge my decisions so harshly because they knew that I might be dealing with something. They'd ask how I was doing, or another good thing. As I said, it's that the dreams of that little girl coming true, and my friends who I also encouraged them to ask for help. The people around me, many people around me started going to ask for help, even because I said psychotherapy saved my life, and antidepressants saved my life. So if you have someone who says that, then someone else might ask for that assistance because it's help, and it's treatment. Shimon, did you also feel relief? Yes, definitely. I mean, I'm known for being a motor mouth. I talk a lot, so my psychotherapist, I spent 10 years in therapy. I took meds. I had 6 here, so at 10 years of psychotherapy, it was difficult breaking up. My daughter even thought I had an affair with my therapist. She told my wife, and she even Googled my psychotherapist to check if she was what she looked like and whether. But seriously, folks, I had a lot of therapy, and the way I approached therapy was that only a year in did I begin actual therapy, because what I did was joke about it for the first year. That was just a strategy. Some people don't say anything. I'm known for saying so much. Only one word in four makes sense. The rest is just glamour and stardust. So, anyway, when I began going to therapy, I started telling everybody, hey, go to therapy. So we, two words in, I say, you really need to go to therapy. And people thought I was marketing, that I was profiting, that I had a share in shares. So if somebody says their hand hurts, I said, hey, might be psychosomatic, why don't you try and get therapy. Okay, I'm speaking lightly, but I encouraged everyone, and even in my stand-up, in my routines, I said, I'm feeling low because my meds aren't working, but I will get back to my usual spiel. Now, I remember when I had my first low, my first episode at the age of 18, what helped me was that the psychotherapist, the therapist I was seeing, told me that a lot of people experience what I'm experiencing. So that really picked me up, the sense that I wasn't alone. I felt that with all the meds, with the insomnia, with the tremors, the breaking out into a sweat and feeling weakened physically, she said that those are symptoms that a lot of people have, and that helped me. I thought I was alone. I didn't know what was happening to me, and I didn't know why I was losing a grip of myself. And when I had the second episode, it also began with psychosomatic systems. I wasn't sure, but telling people that I am seeing a therapist, I thought of wearing a T-shirt saying I'm in therapy. But again, it's important to talk about it. I mean, there was some value judgment if a celebrity says that they're seeing a therapist, that they're accused of being an attention whore, wanting popularity. No, that's not it. Even if there are a couple of people who accuse you of that, the main thing is that a lot of people will sit up and take notice. Justyna Kowalczyk also made me realize that it's time to look after myself. It's time to start talking. I think that's really important, because you're a man, and for men, it's very difficult to speak publicly of their difficulties. Now, Maciej Kurzajewski says that one celebrity says that he loves another celebrity, so men can also be forthcoming. Yeah, a lot of people are very open online. Okay, but men, guys are expected to be strong, the strong, silent type. You carry your load, you bottle it up, and that's what you're expected to do. And here I want to say hi to all my friends who heard me say, did you ever consider therapy? Because you know who you are. So that's what all of us do. In fact, if it works for us, we think it'll work for everyone. When Maciej had his presentation, he said something to the effect that one of the obstacles, one of the reasons he can't teach is that students aren't ready, that they need to be prepared, and that there's a role for education. And here the mechanisms are the same when dealing with mental health issues. And now I want to turn to our medical professionals. Educating at an early age could start off with alliances like the one we're talking about, or in a community setting. So maybe let's have Marek Bawicki go first. I know I'm making it difficult for you, so you get caught off guard. I think we all agree that education is crucial. I even remember Professor Cezary Włodarczyk, who was a scholar and theorist of healthcare and public health, said that $1 spent on education is $100 spent on healthcare. So definitely we need to educate. Education is necessary, and a lot of ideas. Last Wednesday, the Ombudsman's Office organized a meeting of experts on mental health, addressing psychiatric care for children and young adults and youth. And one of the things said was that the school curriculum should not necessarily include controversial topics in current history, but things that really matter, health and mental health, because schools and even in preschool, this is something that ought to be addressed. And if we're prepared, if we know that it's not, that you're not alone, that it's not just you, that depression and disorders and can affect all of us, that it's something that's treatable. So if it's something that's taught us from an early age, and when we see it around us, when we see someone around us changing and requiring some kind of intervention, then we can step in much earlier and obtain much better effects. But I wouldn't be myself if I didn't talk about my field of expertise. Community education, we know that we can all be affected by, I don't like the word disorder, disease, I prefer to speak of disorders, conditions that are treatable. And when we know that, when we see that something's going on, we see a sudden change, somebody loses interest, has no energy, has no longer interested, and we know that that person needs help. So the first thing you can do is provide support and convince that person to get professional help. We know that, but what next? So what about our healthcare system? Is it our GPs, our family doctors adequately trained to identify these problems at their level, and depression can successfully be treated at the primary level? And also the presidents of the Polish Psychiatric Association have drafted guidelines for family doctors. It's a very useful tool, but the question is, do family doctors know? Do we know that family doctors know what to do? Or will it continue to be referred to someone else? And finally, psychological and psychiatric help. What hurts me is that in Poland we have a mental health center at the local level, at the community level, where anybody can go, a loved one, from 8 a.m. to 6 p.m. A walk-in clinics without an appointment, where you can get counseling, where you can get advice, information, or a draft treatment plan. And the person you see is not a psychiatrist, but a psychologist or a community therapist. This is a model that we have in place, we have experience, we have research that's been published and in peer-reviewed journals to the effect that it's a breakthrough, and it's not something that can take root. The National Health Fund doesn't like this approach. It's still stuck, it still remains focused on the past. So if we have one center per 100,000, per population of 100,000, you have 50 family doctors, They know who to work with, and if you have 5 psychiatrists, 5 psychiatrists can work with 10 family doctors each, and this makes it easier. Dr. Krzyżanowska mentioned stigma and self-stigma, so if we're aware of that, and if we run into a wall, if we run into a threshold, a high threshold, if they tell us to come back in 3 weeks' time, it all falls apart, and then it's much more difficult. A lot of people are discouraged because if they're told that they need to wait 6 months or go to a hospital in another region, especially for young people, this can be insurmountable. And in the 50 centers that we have in place, there are no waiting lines. We asked the patients' rights ombudsman about complaints regarding psychiatric care, thousands of complaints, but complaints regarding accessibility are no longer made in those places which have centers. I don't want to get you into matters of politics and policy. As allies, should we lobby the National Health Fund that this is a successful and effective method? So what should we do to ensure that mental health centers aren't limited to pilot project stage? So first we need to quote best practice. We're in Warsaw. This alliance is in central Warsaw, but in neighboring districts there has been a mental health center for some time. There's also a project of integrated care in a community setting. So we need to show that it works, and local communities, if we have 300 powiats or counties, if we have 300 local alliances, our leverage will be such that any government, any healthcare management system will need to listen. And this was also mentioned in the presentation, a sense of agency and empowerment. We need to feel that we have the power, we have the right, we're entitled, we're as individuals, as people, we need to have a say in decisions that concern us. We need to have agency. And so this pilot project could get off the ground thanks to mental health congresses. Dr. Krzyżanowska is the head of the organizational committee. Next year, the 3rd mental health congress will take place. These aren't just healthcare professionals. Half of the attendees are users, people in mental crisis. So together, we were able to accumulate the leverage, the clout necessary to make the ministry sit up and listen. And now we need to have an alliance of local alliances, a nationwide alliance, and let's lobby and pressure the government. But it's not just the government. Dr. Krzyżanowska mentioned stigma, self-stigmatizing, but there's also structural stigmatization, which is evident in the public authorities. They also succumb to stereotypes, and mental health is forgotten, is sidelined. When you look at the breakdown of the budget, psychiatric care gets 4.5% in Poland, while the European average is 6.8%. So Poland still hasn't caught up to the European average, even though we can boast of success. In Poland, the credit cards are more common than they are in the US. So we still can't cross this crucial threshold, right? Let's make ourselves heard, so alliances in every county sound better than a shooting gallery, a shooting range in every county. We have people online, we're getting comments. Beata, bitterly, this might ring a little bitterly, Beata says that access to psychiatry and therapy should be quick. People's lives are at stake, while child psychiatry is a failure. So how can we move from a situation where it's a failure? How can we have hope for improvement? Like you said just now, the need to pressure, to act, to educate. Are we in a good place, or do we keep on saying that we have 400 child psychiatrists, no students interested in the specialization, and it's up to us whether things will be better, because we need to roll up our sleeves. It's not a question just to work. It's not a question of how many psychiatrists there are, but the distribution. It's if these child psychiatrists were in primary care, it wouldn't be so bad, but the working conditions and the conditions in which patients are treated are a disgrace, are demeaning. We don't see this from a Warsaw perspective, but it's enough to visit a clinical hospital and look at the conditions that people are treated in, and the conditions in which the nurses, the staff are working, the medical staff, people trying to help these patients. So that's the structural stigma that Dr. Belicki mentioned. For some reason, you can't imagine in a heart disease, in a cardiology ward, having patients 7 to a room with no bathroom, and that's what you have in psychiatric hospitals. And if we don't get to work as organizations, because I felt this power after the first mental health congress, which we organized, and it looks as if the involvement of NGOs and patient organizations, family organizations, families also joined in, and people who aren't medical professionals but who have a stake. It's not just about treating people who suffer, it's about making society better, so that persons can come back and become valuable, worthy members of society, as somebody mentioned in the previous, in a presentation, because support makes you a taxpayer. You can be a full-fledged member of society, because otherwise you have to live off a disability pension, and it depends on what we do as professionals, but also as patients, as organizations, as NGOs. A lot depends on what we do as structures that are trying to influence the government and the healthcare system. Education is crucial, and research shows that stigmatization, if we want to reduce the stigma, we need to connect, to reach out to these groups that are often stigmatized, which is why Justyna Kowalczyk had such a platform, because she spoke publicly about her condition, and this inspired people who were unwilling to talk. And personal direct contact, it's like a living library. I don't know if you're familiar with that concept. You can borrow a book, you can talk to someone about what's it like having depression, having schizophrenia, what's it like being the mother of a person with ASC. As a psychiatrist, I was also a living book. Persons are intimidated by psychiatrists sometimes. So that's a way for you to become accustomed to this, to other people, to this diversity. Education, I'll need to mention my foundation. My foundation organizes workshops on how to interact with people who've experienced mental crisis. We have trained persons who've gone through that experience. There's a lot of accounts and personal accounts, which also can change attitude, but it's a grassroots initiative, so you can't train a lot to people. But again, this needs to be continued, and it continues to germinate. It continues to. Angelica, tell us about the streetcar. I mean, they don't need a moderator here. So what we did was we rented a tram, a streetcar, and we rode around Warsaw between 12 and 4 p.m. It's mental health and age for help. I just found out that it changed the route, but again, the streetcar is out there. I don't know where it is at the moment, where it'll stop. I don't know Warsaw not being from here, but we have a psychologist who answers questions. I'm sure she gets all sorts of questions, but this isn't psychotherapy. It's not psychological counseling. You can't get that on a tram. We have a piano that you can play. We have materials on how to cope with anxiety attacks, with panic attacks, what abuse can use, like how to recognize, how to identify abusive behavior, how to support your loved ones. And these materials were reviewed by specialists because as our initiative never publishes anything we're not sure will be safe. And you can talk to someone who survived crisis, and there's also a psychologist on board where you can, whom you can talk to. So it's a really good streetcar. Szymon, what was it about the streetcar that convinced you to be Angelica's press spokesman?
When I heard about the tram, then my first question is, how much would I need to pay for the ticket? Is it free of charge? No, ticket inspectors will not be allowed on board. Unless ticket inspector himself or herself will need some assistance. That is true with that caveat. It's a brilliant idea. I suppose you can still catch this tram in Warsaw. Yes, it should be running across the Prague district of Warsaw around this time. It may be overcrowded, though. Now, we are being facetious, but obviously this is a serious business. We are talking about sharing, communicating. Contact information is so important for those who need to be assisted. Now, Szymon, you mentioned 10 years in therapy. If you were to say something to someone who needs help, other than, yes, go and get a therapy, do you have a place to recommend? You mean, do you want me to recommend specific places? Yes, these would be beneficial to the local communities. Well, what I do, I tend to preach on that, but I've referred my friend to the Żoliborz District Counseling Center, a public function that is. Now his problem was not big enough for him to go and pay for psychotherapy, but big enough to go and seek public health care assistance. But in Bielany district, you now have the mental health center available. Yes, I will preach on that too, now that these places are already operational. And you can obtain assistance there quite quickly. Yes, I would share the names and contact numbers with the psychotherapists that I worked with. It is a bit personal. I mean, you share the contacts with people that you know are helpful. Well, my daily work deal with teachers primarily. And then teachers would ask me, yes, but where do I send him or her? Where do I refer my students? Do you know how long the wait time is? So where do you refer? People in need when there are still long lines, waiting time is huge. Living library, would that be the point of referral, perhaps? So what's your step one? What's your first move? I'm not talking about dreams. That will come later if things are kept on an even keel. But what is your first move that you recommend? People who may not know at all what to do and where to go to. Well, this question comes up quite often. First of all, find out if there is a mental health center in your district. If not, if you're unlucky, then look around for NGOs specializing in various programs, support for adolescents or violence victims, mental issues support, or addicts perhaps. So some of those can be identified. In the NGO sector. If not that, I'm afraid paid-for services would be your option. Seek paid-for counseling. Szymon, would you like to follow up on that? Well, allow me, if I may. I have friends who returned to Poland after many years in Switzerland. They are quite well off. They can easily pay for private counseling, but they are still insured in the state-run system. Well, of course, there are some well-known arguments, but what they say is that if I have my family doctor, and when my problem goes beyond the scope of the primary doctor, the doctor will immediately refer you to a specialist. So what you can do is try one of the 50 family doctors in downtown area. They should be educated in terms of the guidelines that experts had put in place, and tell them where specifically they should refer their patients to. But the districts where the mental health centers are not operational, you really need to know specifically where patients need to be referred to. You just cannot leave a patient in crisis without such concrete referral. And not everyone has social support, social capital, so to speak, available to them to be supported by them. So in many places, yes, the situation is quite difficult, but let's start from the primary healthcare. For the primary healthcare to determine the concrete points of referral, that's demand from the ministry that a systemic solution be offered to this situation. The Congress that you mentioned, is there a specific date for that? Yes, it's the end of May, early June typically. Yes, you can take a note of that. And allow me to comment on one other point concerning the meeting with the Ombudsman last Wednesday. If you pour gasoline to the diesel engine, it's going to be a catastrophe, of course. So we have a well thought over three-tiered system for children and adolescents. And this good concept is there, but our favorite National Health Fund wants to pour gasoline into the diesel engine. It is simply not adequate the way they organize funding for the well-construed conceptual model to take off. So we not only know what needs to be done, but we can also put our finger on the points of resistance, points of friction, if you like, for the system to run smoothly. We are now finalizing the second edition of the National Mental Health Program. The first edition was assessed by the Supreme Audit Chamber, and that ended up in fiasco. It is better now. Many proposals under that program have already been implemented, and I think these Congress now will look back at the third edition and identify the roadblocks, the barriers already there in the system. So that will come in half a year or so. We all have enough time to get ready for that Congress. We now have about a quarter of an hour left for discussion. Before I hand over to you, let me ask you, Angelica, we talked about your tram, a very good initiative, though we were being a bit facetious about that. Who writes to you on your teenage asylum? Who are your clients? Who gets in touch with you? Who do you help? Well, I do not know who we do not help, but I do know who we do help. Now, when I was 17, I'd made my decision to take care of my own peer group, my own age group. I've not been a teenager for the past 2 years, but I still handle the needs of the teenagers because I want to work as a psychotherapist of children and adolescents. Well, one way or another, we are approached by teenagers primarily who have no clue about where to go and seek help. On the one hand, there is school, then there are parents who rather than ask, "How are you today? How are you feeling?" they would ask you, "What mark did you get at school today?" Or if they ask, "How was your day at school?" that's already a success story, I would say. Then my answer would typically be, or would have been at the time, in school, same old, desks and chairs, you know. But in each school, you find a school counselor, a pedagogue. You can approach her or him. maybe we've not even approached our parents, and the parents cannot read our minds. I've will bring the microphone to you. Now, what we oftentimes hear from the young people is they do not know where to find a school counselor or a pedagogue, but it seems that it's so transparent and obvious. Mariusz Truskowski, the School in the Cloud, Szkoła w chmurze. Now, let's talk about schools. We touched upon schooling, but a lot remains to be said. Now, by going to school, we induce depressive states in young people. I'm delighted to hear that there is more and more psychological counseling available in schools, but I would like to see a debate open on how to convince the school to embark on a slightly different mode of operation. Now, if you just sit up there and take in the knowledge they give you, and it takes you 12 years to complete, and my only commitment is to receive knowledge and sit up and listen and act on the instructions by the teachers and nothing more, than this is begging. This is really begging for mental problems. Now, how can we influence the schooling system? How can we reshape them? We, as School in the Cloud, do have certain ideas. We want to be instrumental in reshaping the schooling system, build new schools, but there are many odds against which we need to fight. Maybe some of the young people would like to speak on that, but my point is we need to start from the schools, because we churn out young people, school leavers, who later become adults, who become patients of the mental health care or private or private healthcare system. At that, we need to collaborate more with the schooling system to turn it around. I will hand over the mic to you soon. Would you like to follow up on that point, the schools, that is? Well, teachers approach us too, and they ask us, what can I do to help my pupils? Well, I normally say, well, ask your pupils, boys and girls, what is it that they need? There are tutorial classes in the schools. Maybe a workshop to be organized on mental health is something to do. You may ask NGOs, you may ask experts. I may be asked to do that, although I would not have the time for that. So the question is, what is it that you need? Or a questionnaire, perhaps, to be designed for the pupils to be able to anonymously express their views. And we know that there are many changes underway in the system as such, but I believe that the most important change starts from us, from human beings, and from there you take off and change your community or environment. Well, we've been talking here about good practices and what we've succeeded in doing. We do have such success stories to share. In the Bielany district of Warsaw, there was a mental health center funded with the EU money. There, with the assistance extended by the local mayor and local councillors, an alliance was formed. The school does need to be supported professionally. If the school is left to fend for itself, it may not be able to handle the problems and push them out. I remember Dr. Wojdyła, I think we all know her, psychologist. She's written extensively and spoken. She actually once spoke about Norway, which she visited, and where aggression and violence in school was handled not externally in mental health institutions, but locally, in class, in school, with the support of mental health professionals. The school itself will not be able to handle it, especially that many Polish schools do not have a psychologist on the payroll. So we need to break away from this compartmental thinking and acting. We must embrace the more functional approach. And that can be done. If you reach out, you will succeed, and the Bielany district of Warsaw is a very good case in hand. Marcin Morowski, you know, when you talked about the school, well, we all know what the situation in the adolescent or child psychiatry is at the moment. It's just nightmarish. Young heads, Martyna Wojciechowska set up this foundation, and she invites pupils to participate, starting from the primary school, and it's a study on the current condition of the schooling system and the mental health, the mental condition of pupils. And that is a tangible proof that things are getting better, and certainly the current picture is much more positive than a few years back. If there is someone representing the schooling system, please take the floor now, because the invitation we pasted on the internet has been there for the past few hours. Młode Głowy, youngheads.pl. I have a question to Szymon. What made you succeed in integrating the two facets of your personality, the funny celebrity with the more grim side of you? What made me, what helped me? Well, psychotherapy, that's for sure, and the realization that both of these are me, that the scissors have opened up in me. I was a bit neurotic, in that I could not, I was gasping for breath. I got an impression that the world would reconstruct itself every minute or so. I was looking for assistance. Then I thought it was the cardiac problem, hypertension, I thought, and then lung-related disease, perhaps. And then my friends would put it point blank, go to a psychotherapist. That's what you need to do. They told me it's not your heart or lung or whatnot, gasping for breath. And when I rewatched my own TV program, I could see me gasping for breath while, acting out this giddy goat in front of the camera. I was breathing for a number of years as if I couldn't really breathe deep. And that would start off the moment I got up in the morning. So I became aware of what was happening to me. And I had this ominous feeling of a catastrophe approaching, this or that, but always a catastrophe. This catastrophic thinking was a leitmotif. So, and then I would compile a list saying what will certainly go wrong, and then I would look back and see what did go wrong. I'm going on holidays, yes, that's not going to happen. The plane will not take off. My daughter is applying to school now, she will not be accepted. And then when I looked back, it turned out that none of the catastrophic thoughts actually came true. And then I completed my pharmacological therapy. When I took my last pill on the last day, my apartment burned down. And this is what my psychotherapist kept telling me. She would say that things will go wrong that we may not predict at all in the first place, and yet I would reverse that picture and had to make my first steps. But then the realization that other people experience that too was important, or sports. I am pacifistically minded, yet I do boxing. I hit the sandbags twice a week, in fact, and do tough workout in boxing. And my mother would tell me, you just can't hit people in the faces like that. Everyone has a face. You'll get hit yourself one day. But that was important to jet out this bad energy from me. I'm not sure if I've answered your question, but more or less I hope I did. Now that I hold the mic, and then the question would be, after your apartment burned down, what percentage stakes you put on that event happening? But that example is a good, in fact, case. You conjured up here, fueling your car with a different gasoline than it actually needs. It did happen to me, and I know the impact of it. Now, the reason I mention it is that because a few months ago, as the Warsaw Municipal Economic Chamber, we approached the minister with an idea of a new subject on the curriculum in schools: prophylaxis, prevention, because prevention can save lives. I will not take this point any further, but this appeal is still on the table. It is a valid one, an important one. I would like to thank the organizers for this important conference too. But if you look at what the young generation drink and eat, or eat and drink, we are using a wrong fuel, to take this metaphor further. How do we convince them that this is indeed the case? What happens with our bodies, our stomachs, livers, kidneys, not to mention the brains? We are with you as the Warsaw Municipal Chamber of Commerce, and thank you, the mayor of the Śródmieście district of Warsaw. We are now working with the Warsaw Medical Academy to embark on this new subject on the curriculum, the prevention-oriented. And thank you, Doctor, thank you, colleague from Białystok. From your voice, even though you do not use your voice yet, your message was the most pertinent here. Thank you. I'll give the floor to voices from the floor. The three last contributions from the floor, I'm afraid.
It's more of a comment than a question. My name is Dan. My pronouns are they, and I study at the high school in the cloud, and I also have depression. During this conference, I felt frustrated. I feel that as adults, you're starting off from the wrong place. You don't focus, you don't target the causes of depression. You talk about setting up alliances, counseling centers, and so on, but that won't make depression go away. That won't. People will still have depression. You're not doing what you should to respond to many crises. As someone with depression, I can't imagine getting over a crisis, when I'm faced with the climate crisis, when the education system in Poland makes students feel awful, now that Poland is the most homophobic country in Europe, and when across the border there's a war going on. So let me be frank, as adults you're letting us young people down, and that's not helping us cope with depression. On the contrary, it's causing a depression, so because that's where you should start, prevention of depression and prevention of suicide by measures like that. That is a very powerful voice. I don't want it left without an answer. I don't want to force anybody to respond, but I think that it is a very important contribution. As an adult, as a psychiatrist, I'm often ashamed. I feel ashamed for everything we have to say, we have to offer as a system, and as a system of care and prevention. So that I feel that what you said really hit hard and hit home. We can't affect everything, we can't change a lot of things, but I would disagree. I mean, organizing help, organizing assistance, that's something where I can make a difference, which is why I helped organize the Mental Health Congress with a view to changing the situation. When we start changing things, when we set about changing things, you need to be realistic. You need to know what you can change. There's a lot of things you can do, a lot of things you can change, and I intend to carry on going that way. But thank you for your contribution. Anna Mierzyńska, Military Medical Institute. I know that prevention is now the topic, prevention for adolescents and young people. This is important because it's young people who are tomorrow's adults. But for a while, I want to look at another group. I had a look at the proceedings of the mental health congresses for the previous years, which addressed different groups, and working as a clinical psychologist with patients with somatic conditions, my observations treating cardiological patients. So for cardiovascular diseases, depression is a risk factor of incidence and also bad outcomes. On the other hand, heart disease can lead to depression, especially among people who have serious symptoms. My question is, from your standpoint, tell us about psychiatrists working with specialists, with other specialists. I have my own thoughts, but I don't want to fan the flames. Do you have any comments, any thoughts on how we can best exchange experience on, for instance, the medication? Because sometimes this medication can interfere with other medication. And would this be a subject when you look at bulletin boards and internet forums for patients with heart conditions? Depression and mental health is an important issue they address. Yes, thank you very much for that. That is a very important subject. Psychiatry is part of stigma. Psychiatry as a specialization isn't really treated seriously. They don't see it as proper medicine as real medicine. Our colleagues begin appreciating our contribution when they find they can't cope. Complications of somatic diseases, among which depression and anxiety can occur, and conversely, somatic treatment of psychiatric patients should be an area of cooperation, is something we should cooperate on. However, you can't have psychiatry on the outskirts of a city, on the sidelines, where you have no surgeons, no internal medicine specialists. Even you can't quickly do triage in triage to determine whether it's a psychiatric condition or whether it's something to do with the electrolyte metabolism. So psychiatry and there should be somatic care for psychiatric patients, patients diagnosed with schizophrenia and depression, and conversely, patients with somatic conditions should also have access to psychiatric care. And the reform mentioned by the minister, I referred to mental health centers. That's the purpose, because psychiatric wards should be in general hospitals, in county hospitals, which have obstetricians, pediatricians, internal medicine specialists, so they can coordinate their efforts. There's not a lot to add here. Thanks for the question. It is one of the key problems, because on the one hand, you have persons with serious mental conditions, who also have somatic problems, but they're kept outside of institutions that could help them. They're sent to psychiatric hospitals, which are often outside the borders of a city, and you also have concomitant mental conditions, especially mood swings, and in diabetes and cancers, there is depression or low mood is also exists, and so you can't provide somatic or psychiatric assistance for oncological patients, and this is an obstacle. How many psychologists are there in internal medicine wards or geriatric wards and so on? And so what's the way out? Dr. Krzyżanowska said that we need to move beyond mental hospitals that are out of town and move into general hospitals that can treat people with mental disorders. Psychiatrists and psychologists should also be, if they're present in general hospitals, they will be there for patients who don't have serious conditions. There is a mental health center ward in the Wola, Bielany, and Brudno hospitals in Warsaw. So I hope that European funding that we're looking forward to so much, that's where the money will go. Agnieszka Filipowicz, the director of the Social Welfare Center in Bielany. I want to thank Minister Balicki for his support of community care in Bielany. It's working well, and the real time for getting an appointment, for getting a special, is about a week, 2 or 3, and the waiting list is And of course, it's free of charge, and it's so much shorter than the time you'd need to get a specialist appointment in another center. The cooperation is multi-tier and multifaceted. You mentioned schools, Minister, and I wanted to say that we've been receiving great support and cooperation from the Social Welfare Center. Psychiatrists, specialists, and therapists worked with the local population. I'm looking at the younger generation. We're there for you, but I want to also to speak on behalf of senior citizens, persons with various conditions, persons experiencing living with depression. This is a huge group. I don't want to be. So this is an important turning point in their life, and many of them still haven't gotten over the pandemic. If we're talking about support, if we're saying we want to do something for every generation, for the younger generation, for the kids, for adolescents, for teenagers, for adults, and for senior citizens, we need to remember that it has to be local community care, and so that the proverbial dollar spent on health, on prevention, will provide tangible results, and not be redistributing funds for therapy. Thank you very much. You've opened up my eyes. Let me just smile at Dr. Balicki. I'm here in a professional capacity. My son is living with Asperger's. So, doctor, apart from professional expertise, I also want to thank you for. I want to look at Dr. Okstulski. I want to thank you for inspiring us, and I want to promise Mrs. Okstulska that I'll carry on. I'm sorry for speaking in a private capacity, but Dr. Okstulski, hats off, and my greatest, most profound respect and my deepest respect also goes out to Mrs. Dorota Okstulska.
Myślę, że wszyscy jesteśmy
Thank
zgodni,
you.
że to
I
brawa
think
więcej niż
we
zasłużone,
all
to też
agree
brawa, które za chwilę
that
będziemy
this is
musieli
applause
Państwu, mam
that's
nadzieję,
more
powtórzyć, bo
than
chciałabym podziękować naszym
deserved.
panelistom. Dawno nie prowadziłam takiego panelu, gdzie było tyle
Now,
głosów z sali. Dr. Marek Balicki,
I
dr.
want
Joanna
to thank
Krzyżanowska,
our
Angelika Filipik,
panelists.
Szymon Majewski. Wielkie brawa.
And it's been a long time since we've had a panel that was so interactive, and thank you everyone for that.
Ja teraz muszę się odnaleźć w swoim
Now,
programie, który tu
let me look
ja
at
też?
the agenda. Let me just.
Te małe razem. Wspaniale. I teraz się już odnajdę, drodzy Państwo, bo cały czas zapowiadałam, cały czas
And
mówiłam,
here
że po
we
to tu
are. I kept
jesteśmy,
saying
że
that
to
the reason
będziemy
we're
robić,
here,
to
that
będzie
we'll be
nasz
doing
kurs
this,
programu. I ja mam nadzieję, że już
that this
potrenowaliście
is
brawa.
the
I
high point, one of the high points of this day. Let me invite Marta Smagowicz from the Warsaw Against Depression, who has a few things to say. Marta, this won't be the most important thing you hear today, but I would like to thank all of you for coming here and for the great turnout. I especially want to thank representatives of the districts of Warsaw. Your presence here today reaffirms that you see the importance of mental health for residents in your communities and local communities in the districts that you're responsible for. We heard at the beginning of this event words of support for local alliances against depression coming from the mayor of Metropolitan Warsaw, Rafał Trzaskowski, and your willingness to sign this declaration, where you undertake to disseminate knowledge and information about identifying and treating depression is very important, is very encouraging. We've said a lot, our guests have said a lot about supporting one another in local communities, and I hope that these alliances will spread to other districts and cities and municipalities in Poland. And I would also like to thank the district of Śródmieście, Central Warsaw. The first alliance is developing in the district of Śródmieście with the support of Aleksander Ferenc, mayor of Śródmieście, and now representing the mayor is his deputy, Magdalena Wojciechowska. We hope that this alliance will be a good example and will be an example to follow for other districts in Warsaw as well as other towns and cities in Poland. Let's have a round of applause.
Ja teraz będę miała tę przyjemność
And now it's my pleasure to invite representatives of mayors and deputy mayors from the districts of Warsaw. Okay, so let's give them each a round of applause. We'll be signing the declaration. I think that this debate and all the presentations we've heard has shown that it's not about signature, it's about action. Now the deputy mayor of Bemowo.
Pan burmistrz już po schodkach się ustawia i wchodzi Grzegorz Kuca, burmistrz Białołęki.
The mayor of Białołęka.
Pan Grzegorz Pietruczuk, przepraszam, burmistrz Bielan.
The mayor of Bielany.
Brawo, brawo. Czy pan burmistrz jest? No dobrze, zaraz może się odnajdzie. Pani Anna Lasocka, zastępczyni burmistrza Mokotowa.
The deputy mayor of Mokotów.
Pani Dorota Stegienka, burmistrzyni Ochoty.
The mayor of Ochota.
Pan Karol Kowalczyk, zastępca burmistrza Pragi Południe.
Deputy mayor of Praga Południe.
Dobrze, czy godnie reprezentowany. Zapraszamy na scenę, oczywiście. Pani Bożena Polak, naczelniczka Wydziału Spraw Społecznych i Zdrowia Praga Północ. Pan Maciej Iwanicki, burmistrz Rembertowa.
The mayor of Rembertów.
Pani Magdalena Wojciechowska, zastępczyni burmistrza Śródmieścia,
the deputy mayor of Śródmieście, Central Warsaw.
Pan Jacek Duczman, zastępca burmistrza
so
Targówka.
much. The deputy mayor of Targówek.
Śmiało, te brawa, dobrze państwu szło. Pan Jakub Berend, zastępca burmistrza
The deputy mayor
Ursynów.
of Ursynów.
Pan Łukasz Jeziorski, zastępca burmistrza Wawer.
The deputy mayor of Wawer.
Aleksandra Paradowska, zastępczyni burmistrza Wesołej.
The deputy mayor of Wesoła.
Ludwik Rakowski, burmistrz Wilanowa.
The mayor of Wilanów.
Tak. Pan Sebastian Piliński, zastępca burmistrza Włochów.
The deputy mayor of Włochy.
Tak, zrobiłam to. Pan Wojciech Lesiuk, zastępca burmistrza Woli.
The deputy mayor of Wola.
I pani Alicja Tyc-Żardecka, naczelniczka Wydziału Spraw Społecznych i
And
Zdrowia
the
z Żoli
head
Boża.
of social affairs
I teraz
and
państwo nie
health
mogą stać w jednym
department in
rządku, tylko muszą
Żoliborz.
się podzielić schodami.
Now I need
Deklaracja
you
najlepiej na ręce
to-
pani burmistrz ze Śródmieścia, bo zaczęli.
Let's
Tak
put
jest.
the declaration.
Do zdjęcia,
let's
do
hand
zdjęcia.
the
Sesja zdjęciowa musi być
declaration to
porządna.
The deputy mayor of Śródmieście, because they
O,
were
specjaliści
first.
pomogą ustawić naszych
Okay, so
specjalistów.
let's have a photo.
Oczywiście. Godna reprezentacja Bielan jeszcze tutaj dołącza. Poczekajcie Państwo. Tak, zapraszamy.
And let's have someone from Bielany.
Muszą ich Państwo jakoś rozśmieszyć, mam wrażenie.
I think,
właśnie.
yeah, we need to get a smile.
Mamy to. Dziękujemy, wielkie brawa. Państwo będą
And
uciekać
there
ze
it is.
sceny, ale nie całkiem stąd, dlatego że tam po lewej
On
będzie za
the
chwilę stoliczek, gdzie
left-hand
naprawdę
side
podpiszecie, a nie
we'll
tylko
set up
symbolicznie.
a
Więc
table where
długopis się
you'll be
przyda, jest tam
signing
też długopis,
the
więc zapraszam wszystkich
declaration.
Państwa do
We have
podpisywania.
Pens.
Tak.
So let's have all of you sign
Pani burmistrz
the
pierwsza, tak.
declaration.
Zróbmy
Let's
tak. A
have
potem już Państwo mogą sobie wybrać
you go
kolejność.
first and then you decide.
No, i to podpisywanie trochę potrwa. Państwo
this
też nigdzie nie
will
uciekają. Ja wiem, że to były takie osoby, które mnie
some
pytały, a kto jest z Bielan? A
I
kogo
know
trzeba złapać
you-
z Wilanowa, bo macie tutaj swoje różne interesy
I know you
w
all
zakresie zdrowia
have your
psychicznego do
little
załatwienia
fish
i
to
to
fry
bardzo,
when
bardzo
it comes
cieszę.
to mental
Miałam wielką
health.
przyjemność spędzić z
Some of
Państwem
you
to
came up to
przedpołudnie. Mam
me
nadzieję, że
and,
wyjdziecie stąd zainspirowani,
asked me,
chętni do działania,
who to turn
zapoznani
to.
z
It
wieloma
was a
nowymi
pleasure
inicjatywami
being with you
i
here
działaniami.
today.
Zachęcam serdecznie do
This
śledzenia Aliansu
opportunity
Przeciw
to,
Depresji, również w mediach
find out
społecznościowych,
what's new,
dlatego żeby ta warszawska
follow
praktyka,
the
dobra praktyka
Alliance
szła
in
dalej w
social
świat.
media, and
Będzie obiad, będą
we
kuluary,
will
będą
be
rozmowy.
serving lunch.
A ja bardzo
There
dziękuję
will be
i jeszcze raz
time
gratuluję wszystkim Państwu
to talk.
zaangażowania w
Meanwhile,
sprawy zdrowia
thank you
psychicznego.
for
Wielkie brawa na
being
zakończenie.
here
Poproszę.
and congratulations on everything you're doing for mental health. One last round of applause.
I zaraz się dowiem, czy o czymś zapomniałam, ale mam nadzieję, że nie.
I
Zachęcam do
hope I
rozmów,
haven't forgotten
do gratulowania, do
anything.
podpisywania.